Cabinet has decided that Auckland needs to stay at Alert Level 3 as it currently stands for another week before we can look again at any further easing of restrictions. Cabinet will review that position when it meets again next Monday. And over the next few weeks, while we lift those levels of vaccination for everyone, we need to maintain restrictions to stop the virus from spreading both in Auckland and to other parts of the country. On schools in Auckland, schools will not reopen on the 18th, and further public health advice will be provided next week. Distance learning will instead recommence at the beginning of Term 4. Students who are currently able to access education facilities will continue to do so. In the meantime, can I ask students and their parents and caregivers of those aged 12 or over to please use this week to be vaccinated? Now, onto our other regions and their restrictions. In the Waikato, we have a clear example of our tried and true method of stamping out the virus working. More than 23,000 tests have been done since the first cases were reported on the 3rd of October. That is 4% of the population. This helps to give us a level of confidence that there isn't any undetected community transmission. However, our public health team on the ground have asked for more time to reassure themselves that we do not have cases that are more widespread. As a result, the advice we have received and agreed with is that the Waikato should remain in Alert Level 3 till 11:59 p.m. on Thursday, the 14th of October. On Wednesday, Minister Hipkins will then confirm the move to Level 2 if the health team and Cabinet are satisfied it is safe to do so. Now to Northland. Here, unfortunately, we have a situation where we have an uncooperative COVID-positive person who is refusing to divulge their movements, and where they have a female travelling companion we have identified but cannot locate. We've pieced together what we can from CCTV footage and other means of police investigation, but we know this is not necessarily telling us the whole story. While we haven't had any new cases from the 2,179 tests taken since the case emerged on Friday, without clear information of exact places and locations the person travelled to, we are relying on high rates of testing across the entire region to give us the confidence we need that there isn't any undetected community transmission. As you can imagine, this is an incredibly frustrating situation, the likes of which we've seen very rarely in our COVID response before. And given how extraordinary it is, I have asked Health to consider all of the options available to them as they and the police work with the individuals involved. In the meantime, decisions need to be taken. So far, only 1.1% of the region have had a test over the last 48 hours. Thank you to everyone who's come forward. But this needs to be much higher to make sure we have the certainty that there aren't undetected cases. This is especially important given in Northland we do currently have lower vaccination rates. So on that basis, Northland will also stay at Alert Level 3 for a further 3 days until 11:59 p.m. this Thursday, the 14th of October, with Cabinet again reviewing those settings on Wednesday. This is a tricky period in our COVID response. I understand why people will ask and want more certainty than we can provide right now, and that's because we are in new territory. But our goal remains the same, even if the approach to achieving it changes. We have a pathway forward, and we remain in a very strong position to make the transition from lockdown restrictions to the individual armour of vaccines while maintaining our world-leading position on case numbers, hospitalisations and deaths, as well as delivering a strong economy and low unemployment. In the coming weeks, I'll outline the framework for our next steps as vaccination rates lift. Our Reconnecting New Zealanders plan remains, and you'll see announcements at the end of this week on our self-isolation pilot, which takes place shortly. And for the next few weeks, we'll continue to be careful and methodical in our decisions while getting everyone we can vaccinated. And you'll see that in the decisions that we have taken today.
Our education and health and disability workforces have done an incredible job throughout this pandemic, keeping themselves and the people who they care for safe. Vaccination remains our strongest and our most effective tool to protect against infection and disease, and we need as many people as possible to be vaccinated to allow all of our sectors to respond to the pandemic whilst continuing to deliver everyday services with as little disruption as possible. Most of the people working in these sectors are now already fully or partially vaccinated, but we can't leave anything to chance, so that's why we're making it mandatory. It wasn't an easy decision, but we need to have the people who work with vulnerable communities who haven't been vaccinated to now take this extra step. Vaccinations for children aged 11 to 5 are not yet approved, and the health and disability sector includes a range of high-risk occupations. People have a reasonable expectation that our workforces are taking all reasonable precautions to prevent the spread of disease, and the government agencies have been working with them to ensure that they're as protected as possible. A high rate of vaccination will help to protect staff from getting sick and help to protect them from passing that on. It'll also reassure those who are anxious about their children returning to a school or an early learning service. So, to the details. Cabinet's agreed that high-risk workers in the health and disability sector will need to be fully vaccinated by the 1st of December. They'll need to receive their first dose by the 30th of October. This includes general practitioners, pharmacists, community health nurses, midwives, paramedics, and all healthcare workers in sites where vulnerable patients are treated, including intensive care units. We'll also be including certain non-regulated healthcare workforces, including aged residential care, home and community support services, kaupapa Māori health providers, and non-government organisations that provide health services. Schools and early learning staff and the support people who work with them, who have contact with children and students, will need to be fully vaccinated by the 1st of January 2022, and the target for them to receive their first dose is the 15th of November. That includes home-based educators, all those who support people in our schools and early learning services such as teacher aides, administration and maintenance staff, and contractors. Secondary schools in kura will also be required to keep a COVID-19 vaccination register of their students. Students that don't produce evidence of vaccination will be considered unvaccinated. All education workforce employees in Auckland and other Alert Level 3 regions will be required to return a negative COVID-19 test result before they can work on site at such time as their schools are able to, and early learning services are able to reopen. Those who are not fully vaccinated in the period leading up to the 1st of January will be required to undergo weekly COVID-19 testing until they are fully vaccinated. Work is continuing on what the vaccination requirements, if any, around the tertiary education sector should be, and I'll provide an update on that in due course. In the meantime, my strong plea to everyone is please get vaccinated.